Dear committee, dear audience, thank you. Let me start with my thesis title, Eating and Feeding Difficulties in Children with Autism Spectrum Disorder from Background to Tailored Treatment. My name is Krisztina Szalkay. I'm a pediatrician and a child and adolescent psychiatrist and work at Betesda Children's Hospital in Budapest. My mission is identification of potential evidence-based therapeutic targets in autism with eating and feeding disorder. My vision is equality for autistic children and their families. To achieve my mission, I have two ongoing projects. My first specific goal is investigating the severity of eating and feeding difficulties in autistic children with or without atypical sensory processing by conducting a systematic review and meta-analysis. Why is this topic so important? What do we know about the background? Autism is a more and more commonly diagnosed neurodevelopmental disorder with a 2.2% estimated prevalence. About 80-90% of autistic persons experience sensory processing issues, which is the part of the core symptoms. The rate of eating and feeding difficulties in autism is extremely high, about 70%, and they are related to several medical and developmental consequences. They have multidimensional etiology with an interaction between many factors. One of the main factors is sensory processing. By now, the association between sensory disturbances and eating-feeding problems is evident. However, the latest studies could only confirm the significant role of oral modalities, even though our clinical experience highlights the importance of all other modalities as well. It's not surprising because during mealtimes, a huge amount of stimuli arrive from all sensory modalities, what can be overwhelming for an atypically developing nervous system. Despite its high frequency, the evidence-based therapy of this complicated problem is still missing. The autism-specific behavioral therapy by itself, in many cases, is not effective enough in the aspect of eating difficulties. Among other factors, it can be due to the lack of targeted treatment of sensory difficulties. So our aim is to understand the association between feeding difficulties and sensory integration in relation to all modalities to be able to extend the current therapy. Our clinical question is, does atypical sensory processing in autism associate with the severity of eating or feeding difficulties? Our population is autistic children, exposure is atypical sensory processing, the comparator is typical sensory processing, and the outcome is the severity of eating, feeding difficulties. Our hypothesis is autistic children with atypical sensory processing demonstrate more severe eating, feeding symptoms compared to those without atypical sensory processing. The study has important clinical implications, especially for patients, because receiving additional therapy can decrease the incidence and the severity of these difficulties. For clinicians, the study can lead to understand the multi-interdisciplinary background and the importance of individualization. I've conducted my systematic search in 4 databases. Here you can see my hits and my search key with its 3 domains. Altogether found more than 11 articles, and after the title abstract selection, I have now 103 articles, and then I've just started the full text selection. So let me introduce my second project. We are planning a protocol for a prospective observational multicentric study about investigating the rate of autism and atypical sensory processing in children with eating and feeding difficulties. Few more words about the background because it's strongly related to our meta-analysis. So in autism, the rate of eating, feeding difficulties and sensory disturbances is extremely high compared with the typically developed population. The overlap and the association of these factors pose many challenges in clinical practice. First of all, the eating-feeding problems can be more severe and can be treated less successfully in individuals living with autism. On the other hand, in many cases, the eating problems can be the first symptoms of autism and appear well before the onset of the typical behavioral symptoms. They are often resistant to treatment just because we neglect the underlying neurodevelopmental condition. I'd like to emphasize that without early recognition and targeted intervention, serious consequences can be expected related to both the untreated autism and the eating difficulties. So that's why we would like to clarify the rate of autism and atypical sensory processing in the background of eating, feeding difficulties in childhood. We ask, what is the prevalence of autism and or atypical sensory processing in relation with eating, feeding problems in childhood? We investigate two conditions, autism and atypical sensory processing, in the context of eating, feeding difficulties in the population of children between 3 and 10 years of age. Our hypothesis is children with eating, feeding problems have higher prevalence of ASD and or ASP. The clinical implications for patients, our study's clinical implication for patients would be early detection and intervention decreases the consequences of both eating, feeding problems and autism conditions. The message for policymakers is that treatment requires complex diagnostic and intervention programs. So finally, with these two ongoing projects, our aim is to understand better this complicated multifactorial disorder to be able to improve the supportation of autistic children and their families. I would like to thank you for your attention with brilliant thoughts of Piglet from Winnie the Pooh. The things that make me different are the things that make me me. Thank you very much.
Thank you very much. I was shocked with the data that the eating difficulties can be 10 to 25% in the non-autistic population. What are we talking about? What are these problems which are so frequent?
They can be very different, but limited variety of food, food refusal, unusual mealtime behavior can all.
So it's mostly the babies. So it's not like
not necessarily in babies, in the older ages as well.
Sorry, can I have a question? A great presentation, very interesting topic. So I'm just curious, during the first presentation, what are the nutritional status of these children with feeding and eating these difficulties? Are they obese or malnutritive? What are the percentage? Thank you.
Thank you very much for your question. This is the main concern of the parents as well. So what about the nutrition and what about the health? So according to recent studies, I can say about 50% of these children live with normal BMI. So they don't show any physical symptoms. About 20 to 30% are underweight and about 10 to 20% are obese. It varies across the studies. There is a geographical difference as well. So for example, in Latin America, there are more obese children than in North Europe. But the main problem is, in most cases, not only the weight, but the consequences of the imbalanced diet. So in many cases, vitamin C, D, A deficiency, magnesium, think selenium deficiency was reported, and with its consequences, for example, scurvy. So there are many articles about scurvy in autism. Thank you for your question.
Perfect presentation. Thank you very much. My question would be, is there a difference, like you mentioned in your second topic that feeding difficulties arise as a first symptom, but can we differentiate between the normal feeding difficulties and the feeding difficulties that occur in autism?
Mm-hmm. Thank you for your question. They are not necessarily different, as I have mentioned before, but there are some typical patterns, some typical signs what can raise our suspicion. For example, the age of onset of these problems is very typical. It's around 1 year of age. By the time when around the time when the parents introduce the semi-solid fluids to the exclusive breastfeeding. The other aspect is the sensory aspect. So these children, the autistic children, select by the look, the smell, the taste, the texture of the food. So and the noise of the food. So it is a very specific symptom. And the behavioral patterns can be very specific. So they are crying, they are eating alone. Their frustrating can lead to tantrums, for example. So we can see it in a typically developed children, usually.
Thank you for the...
Two questions, all right. Two questions.
So thank you for the excellent presentation. I was wondering that how can you measure the severity of eating problems and sensory difficulties?
Thank you for your question. There are validated standardized questionnaires for children regarding to mealtime behavior in autism and sensory processing issues as well.
And the very last question?
The question was asked.
Oh.
The question was asked.
So.
Thank you very much for your presentation. I just have a question for myself. With regard to the population that you were talking about between 3 to 10 years old children, did you come across any information regarding the gender of the children? Since I personally read about this and I was very interested, and usually the diagnosed patients mostly are males, or that's my question, if you ever came across any information with regards to that.
Yes.
Thank you.
The autistic, the males are overrepresented in the autistic population. Yes, there is a data, the well-known data. Thank you. Yes, we will. I think yes, because it's a question in our questionnaire. Yes.